Our last presentation today is about Your Health Matters. It's by Dr. Hamad Khan, who's a consultant pediatrician in St. Thomas's Hospital, and Dr. Mahmood, who is a cardiology reg in Royal Free Hospital. So I'd like to invite them about an essential part of our everyday life, our health, our well-being. Thank you.
Assalamu alaikum wa rahmatullahi wa barakatuhu. You may be wondering why a pediatrician is talking to you about your health. I'm assuming there are no children here today and everyone is over the age of 18, in which case my advice is going to be not of a great deal of use, but Dr. Mahmood is, by the grace of Allah, a cardiologist and has a lot of experience in dealing with ill health in older people. But what is probably more important than dealing with ill health is preventing ill health, and I think cycling definitely up there, and so I would advocate for the cycling club, which has already presented, and Dr. Mahmood is going to give some sage advice now on how to prevent ill health and lead a healthy lifestyle, and then inshallah we can take some questions and do a bit of interaction, and I might ask him some questions myself. Jazakallah.
Or we just sit here?
It's up to you. I mean, it's a moment of relax. You can sit down.
Okay. Bismillahir-Rahmanir-Rahim. Auzubillahi minash shaitanir rajim. Bismillahir-Rahmanir-Rahim. So I think first I'll start out with the point. I was watching a Q&A session of Zuhr, and he was talking to Ansarullah in another country, and the person who was talking to Zuhr was 70 years old. Zuhr said, "I'm fairly close to you in age, but not in the way I talk in how I work." And that was quite interesting because Zuhr's taken good care of his health. So I think we'll keep this mostly interactive. So I'll ask the audience a few questions and we'll go from there. So what do you guys think is the average life expectancy of a man in this country? Does anybody know what is the average life expectancy of a man in this country?
You can come up to the front, please. 82?
Well, unfortunately, it's decreased. So, at this moment in time, it is now 79.5. Now, interesting enough, despite what you guys think, for an Asian man, for example, of let's say of Pakistani origin, the life expectancy is 82.3 years, which is pretty good. If you have crossed the age of 65, you on average have 18.8 more years to live as a man. So it's quite a long life expectancy. For an African man, it is even longer. If you are from not Africa, Caribbean, if you're from Africa itself, 83.8, and is actually the native population in this country. So if you who have a lower life, if you are a white person born in this country, apologies for the term, but that's the ethnic definition used by the government, is actually 79.7. For Indian people, for people who identify as of Indian origin, it is again 82.3. Yeah. So the first thing I try to say with the blessing of God, the life expectancy for an Asian person is a misconception to think that it's actually less. It's actually more than a person born in this country, and probably a lot of this is due to the fact that we don't drink as much alcohol as this local population. We'll go into this in a minute. Okay. So the second thing is, what is your chance of getting either a heart or circulatory disease in your lifetime? Can anybody guess? Does anybody want to guess? Yeah. What is your chance of getting a heart or circulatory? Circulatory illness is so anything involving your heart, and anything involving your legs, like peripheral vascular disease, which is basically disease of the arteries of your legs, or a stroke.
Do people think everyone will get a heart attack at some point? Do you think that? No? Yes? So 50%?
50%, he's actually right on the mark, 50%. But interesting enough, in 1961, this was half of all deaths in this country were related to heart or circulatory disease, but we've made great progress. Yeah, it's now only the 1/4 of people in this country will die of a heart or circulatory disease, yeah, which is a big deal in the sense that we've had a huge reduction in death rates from this over lifetime. But still 40,000 people every year under the age of 75 will die of a heart or circulatory problem, yeah, which are still big numbers. And this is why if you get to 65, you're actually lucky, because then you've got a lot of years left, yeah, if you're taking good care of yourself. It costs this country a lot of money, about £9 billion, because the problem is that if you develop a heart or circulatory illness, you may not be able to work, you may have to retire, you will have a lot of disability. So, you lose quite a lot of money from this. Now, the other thing I want to ask is, what do you guys think is the biggest cause of death in this country, apart from COVID, which is temporary? But what are the biggest causes of death in this country? Can anybody guess? No. The biggest cause of death in this country is Alzheimer's, number one by far. So dementia is number one now, and it is enormous. So we think that there are about 150,000 people with dementia in this country. By 2050, there will be 350,000. One of the biggest contributors is obviously if you have diabetes of any sort. Yeah, this is a big contributor to dementia. So the number one cause of death in this country is Alzheimer's, dementia on death certificates. Number two is any form of heart disease. Number three is a chest infection. Yeah, but if you're old and frail and you get a chest infection, you can die. Number four is lung cancer. And this is important to understand, that 1 in 7 adults in this country smoke. And I know obviously some people on the Jamaat still smoke, but and obviously a lot of lung cancer can be traced back to smoking. The fifth biggest cause is a stroke. Yeah? So heart attacks are very common in this country, very, very common. How many people are admitted with a heart attack in this country per year to hospital? Can anybody guess? It's quite a big number. Any number would be welcome. So it's about 100,000. Yeah, 100,000 people a year are admitted to heart attacks in this country. It's quite a large number. And the interesting thing is that 7 out of 10 of these people used to die in the 60s and 70s. Now 7 out of 10 will survive, but 3 out of 10 will still die. So if you have a heart attack, you use it. So this is what people need to understand. A heart attack is not something that happens suddenly. In reality, a heart attack is something that comes from damage to your blood vessels over your lifetime. So let's say you smoked, or you were overweight, or you had diabetes, or you didn't exercise. Yeah. So 1 in 7 heart attacks are caused by obesity. 28% of the people in this country are now overweight, and 30% of children are overweight. This is what we call the obesity explosion, which is happening all over the world. Actually, let me ask, which country is the most obese in the world? Can anybody guess?
America.
Close, but unfortunately Mexico is first, because Mexico was where the American companies went in and sold all their Coke and Pepsi and whatnot. They have the highest consumption of fizzy drinks in the world. So they experimented on Mexico first, and then they went back to America. We are only number 5th as far as obesity is concerned in the world. So we're quite behind actually. Probably we're leading in Europe also. Maybe part of the reason for Brexit, we couldn't actually fit in there. So, we have about 100,000 strokes in this country every year as well. Quite a large number of strokes. And this is what people need to understand. Obviously, the number of strokes, heart attacks is quite enormous. Strokes don't lead to as much death as heart attacks, but lead to a lot more disability. And a lot of the dementia that we were talking about, the vascular dementia, actually comes after a stroke, unfortunately, because you have a series of strokes, etc. So if you have diabetes, you're 2 to 3 times more likely to have a stroke. Okay? Now, if you have type 2 diabetes, which is the commonest form of diabetes in this country, yeah, and you lost a significant amount of weight, yeah, if you reduced your BMI, let's say you to 25, or in essence you basically managed to bring yourself back to a normal weight, what is the percentage chance that your diabetes will disappear? Will disappear, in essence you won't need tablets for it.
You don't, and that means you don't need any medication. You can reverse your diabetes. Do you think it's possible?
Maybe. It's about 50%. So 50%. So this is where there's a continuum. So a lot of people, as they get older, will develop what we call borderline diabetes. So they have we know that the body systems are struggling, their pancreas is struggling. And then they go on to have diabetes, and as we define as diabetes, and then they need tablets and eventually insulin. But if those people lost weight, half of them would not require any medication. But it's a drastic weight loss. You're talking about quite significant amounts of weight. Yeah? The other thing is actually, even if your normal weight, it's better to be a little bit thinner. Yeah? It's better to be a little bit on the thin side, because there's data to show if you're a little bit on the thin side, if you're actually, let's say, as an Asian person, your BMI is less than 23, you will do better in your lifetime. Okay? Now, how many people do you guys think have diabetes in the UK? Can anybody guess? It's 4 million. 4 million. So a lot of people, actually, interestingly enough, and possibly some people in this room, do not know that they have diabetes. And obviously there's a lot of health checks now in this country, and people do get tested, but there are 650,000 people in this country who we estimate have diabetes and don't know about it. Yeah? Sometimes we see this in hospital, where they present with a heart attack or a stroke, and we say, oh my God, your blood sugar is high. And obviously that was the main cause of their heart attack or stroke. They have a much, much higher chance, as we discussed before, of getting a heart or circulatory illness, much higher, 3 times higher than that of the ordinary population. So as a diabetic, your risk of getting a heart attack, stroke, kidney failure, etc., is much, much higher, and therefore you need to reduce that risk. Yeah? As we discussed, so let's just go through quickly the risk factors in turn. So 1 in 7 people in this country smoke. Yeah? We have 15,000 smoking-related deaths per year. There is no amount of smoking which is good for you. Yeah? You should, if you do smoke, try stop smoking. It's the number 1 risk factor for disease, for any sort of heart disease in this country. The second thing is diet. Yeah? So only 1/4 of adults in this country, by definition, take the amount of fruit and vegetables that is required or recommended. Yeah? It's quite a small amount. So, and we know that 1/7 of heart attacks are related to people not keeping their diet under control. This is a significant percentage. Yeah? So one of the things I was reading once Muslim Madrasa wrote is that he said that the reasons the Muslims were able to overcome the armies of the Romans and the Persians, one of the reasons was that the Muslims actually, it wasn't just prayer, it's the fact that they practiced. Yeah? They would exercise, they would practice all day, so they were ready for these battles. Yeah? So they kept their bodies fit. This is one of the recommendations. He said we should try and be fit, because this is how the Muslims, one of the reasons the Muslims overcome all these armies. Now, thankfully in our Jamaat we don't have this problem, but 1/4 of people in this country drink too much alcohol. And if you look carefully, what are the reasons why in the life expectancy gains have stopped, and people are actually now especially, for example, in Scotland, life expectancy is significantly reduced, is because of alcoholism. Alcoholism is a growing problem, and in lockdown has been a huge problem, because people can actually have alcohol delivered to their house. So we're very, very lucky to have Ahmadiyyat and Islam, which prevents us from doing that. Now, just some other more dangerous things. Now, if you have had a heart attack, and this is very unfortunate, and I do tell this to my patients, and they find it very uncomfortable, but you have a 20% chance of having a stroke, heart attack, or death within 1 year. Yeah? Because you've reached that end phase. You've had a lot of damage to your body already, and you've reached that level where there is a lot of damage in the arteries of your body, and therefore your risk is quite high. But even for those people, I'll say, look, a lot of people won't listen, but you could be that person who's the exception, who can completely change his lifestyle, who can exercise, who can lose weight, who can change their diet, and be that person I meet 15, 20 years later, and he's still not had a heart attack or another heart attack or stroke, his stents are intact, he's doing well. Yeah, and there's lots of people who have made that change. So I think that so just summing up, because I think we don't have that much time left, so we'll stop for questions, and obviously Ahmad will say a few things. But Asians, this is a misconception, yeah? The Asians are unhealthy and they live less than the local population. That is not true. Asians are healthier overall than the native population of this country and have longer lifespans. And people from Africa have even longer lifespans than Asians. So this is a misconception, yeah? And if you take good care of yourself, there is no reason for you not to live to that lifespan in a healthy manner. What you're doing is, by improving your lifestyle, you're giving yourself extra healthy years. Yeah? You give yourself an extra 5, 6, 7 years where you're healthy, you can spend time with your family, you can do your Jumaat work, and you're healthy, rather than spending your 70s with some sort of disability or problem. Okay, but I'll stop there.
जज़ाकल्लाह महमूद, आपसे गुजारिश करूँगा कि उर्दू में भी कुछ हमारे लोग हैं जो पसंद करेंगे कि उर्दू में भी थोड़ी सी एक्सप्लेनेशन हो जाए. मैं आपसे सवाल पूछूंगा फिर महमूद साहब के आपने डरा दिया लोगों को कि ये सारी बीमारियां हैं. बहरहाल बीमारियां तो हैं और उससे छुपना भी नहीं चाहिए, लेकिन असल बात तो ये है कि कुछ कर सकते हैं उसके बारे में, और क्या चीज़ें हैं, आसान क्या चीज़ें हैं जो कोई कर सकता है ताकि वो इन बीमारियों से बचे, और कि अगर खुदा न खास्ता कोई ऐसी बीमारी हो जाए, डायबिटीज़ या हार्ट डिज़ीज़, उससे वो आगे किस तरह बच सकें और अपने सेहत को ठीक ज़्यादा बेहतरी की तरफ लाएं.
तो वो तो है कि डायबिटीज़ में तो लो ग्लाइसीमिक इंडेक्स ख़ास डाइट होता है, लेकिन अपना अगर आप वेट कम करें, एक्सरसाइज करें, फ्रूट वेजिटेबल लें, गोश्त कम खाएं. अगर आपको हार्ट अटैक हुआ है तो अगर गोश्त तकरीबन बिल्कुल छोड़ दें तो बेहतर है. ठीक है, गोश्त और स्पेशली फूड जो हम लेते किस कंट्री में प्रोसेस फूड लेते हैं वो काफ़ी मसला है. प्रोसेस फूड का मतलब असल में ये है कि 200 साल पहले लोग ये प्रोसेस फूड नहीं होता था जिस तरह हम खाते हैं, और उस ज़माने में लोग जो कैलोरी जो थी जो खाना है वो अमाउंट तकरीबन वही थी जिसकी एनर्जी जो उसकी है. लेकिन क्या फ़र्क पड़ा है कि जब प्रोसेस फूड आया है जो फैक्ट्रियों में बनाते हैं तो वो आपका बॉडी ज़्यादा तेज़ी से अब्जॉर्ब करता है, वो आपके लिए ज़्यादा डेंजरस है. तो मेरा पॉइंट ये है कि प्रोसेस फूड अवॉइड करें, गोश्त कम खाएं, वेजिटेबल ज़्यादा लें, फ़िश अच्छा है आपके लिए, खाना चेंज करें, ये नंबर 1 चीज़ आप कर सकते हैं. दूसरा चीज़ ये है कि एक्सरसाइज का हम कहते हैं कि 150 मिनट पर वीक, लेकिन अब एक्सरसाइज की डेफिनेशन दोबारा चेंज हो, कहते हैं कि सिर्फ ये नहीं है कि रनिंग या वॉकिंग, वो है रेजिस्टेंस ट्रेनिंग भी करनी है. रेजिस्टेंस ट्रेनिंग का वेट लिफ्टिंग या इस टाइप का रेजिस्टेंस ट्रेनिंग बहुत ज़रूरी है. ठीक है, अगर आप वेट लूज़ करें और एक्सरसाइज करें, दोनों करें, तो आपका वेट लॉस मेंटेन रहेगा. ठीक है, अगर आप सिर्फ वेट लॉस ही कोशिश करते रहें तो मसला ये होता है कि वो वज़न लूज़ करते फिर दोबारा वापस आ जाता है. ठीक है, लेकिन आप एक्स्ट्रा ईयर्स, आप एक्स्ट्रा साल आप ज़िंदा रह सकते हैं इसके साथ, खुदा के फजल के साथ. ठीक है, अगर आप अपने लाइफस्टाइल में चेंजेस करें, ये सबसे आसान काम है और तमाम दवाइयों से ज़्यादा इफ़ेक्टिव है. जो दवाइयाँ जो हैं उनकी इफ़ेक्टिवनेस जिसके इज़ कम्पेयर टू अगर आप एक्सरसाइज करें और वज़न कम करें कम है. ये बहुत सबसे ज़्यादा इफ़ेक्टिव तरीका है अपने आप को वो हेल्दी रखने का हार्ट के लिहाज से.
कोई सवाल है, कोई क्वेश्चन? जी
अस्सलाम वालेकुम रहमतुल्लाह वबरकातुहू. खाकसार हल्का बैतल फतू से है, तो ताहिर अहमद चुगताई मेरा नाम है। तो मुझे 2014 में हार्ट का स्ट्रोक हुआ था और 2016 में मुझे ब्रेन का स्ट्रोक हुआ था। जब हार्ट का स्ट्रोक हुआ था तो मैं 72 घंटे हॉस्पिटल एडमिट रहा था, बेहोश रहा था। तो अब मुझे व्यूरोफीड दे रहे हैं और कभी वो थिक हो जाता है खून, कभी पतला हो जाता है। और अब जब मैं चलता हूँ तो मुझे काफ़ी, जब सीढ़ियाँ चढ़ता हूँ सांस चढ़ जाता है काफ़ी। तो इसके मतलब कि थोड़ा सा कोई गाइड करे तो जज़ाकल्लाह।
हम तो इंडिविजुअल इस तरह एडवाइस नहीं दे सकते पब्लिक में। आप अगर बाद में मुझसे बात कर लें तो इस पे डिस्कशन हो सके, लेकिन जनरली आपको ये बता देता हूँ कि जो बहुत सारी नई दवाइयाँ आ गई हैं जो हार्ट के कंडीशन को इम्प्रूव कर सकती हैं, और अगर इंसान एक्सरसाइज करे तो उसका हार्ट की स्ट्रेंथ बढ़ जाती है। अगर वज़न कम करे तो अगेन हार्ट पे बोझ कम पड़ता है। और जो नई दवाइयाँ जो आई हैं, कुछ इस साल आ गई हैं, अगर उनको ट्राई किया जाए तो हार्ट की कंडीशन बेहतर हो सकती है।
जज़ाकल्लाह।
वालेकुम सलाम।
अल्हम्दुलिल्लाह मैं इस वक्त 70 ईयर्स का हूँ।
अच्छा, माशाल्लाह।
तो मैं आप सब इंसार भाइयों से एक थेरेपी शेयर करना चाहता हूँ। 1996 में मैंने अल फज़ल अखबार में पढ़ा कि जो लोग गार्लिक खाते हैं उनके ये फ़वाइद हैं। मैं उस वक्त 45 का था। तो सिंस दैट डे टिल टुडे मैं सुबह एक गार्लिक का छोटा सा पोर्शन लेता हूँ, 3 गिलास बड़े वाले गिलास, हाफ नीम पानी, गर्म पानी, वो मैं पीता हूँ। उससे पहले मैं एक्सरसाइज करता हूँ 10 to 15 मिनट्स, और एक्सरसाइज मैं लेट के करता हूँ। नाउ डेज एक साइड पे लेटता हूँ, ये मैं लेग ऊपर करता हूँ अबाउट 30 टाइम्स, फिर इसी लेग को मैं पुश करता हूँ अबाउट 15 टाइम्स, फिर इस लेग को मैं आगे पीछे करता हूँ अबाउट 30 टाइम्स, फिर दूसरी साइड, फिर बाजू ऐसे ऐसे करता हूँ, पुश अप करता हूँ अबाउट 40 टाइम्स। तो कहने का मकसद ये है, अब मोस्टली जो इंसार भाई इधर बैठे हुए हैं वो 60 प्लस होंगे, इनके लिए तो कोई है नहीं, मगर जो यंग जनरेशन है, यंग मीन आफ्टर 40, अगर ये आप एक्सरसाइज करेंगे तो इंशाअल्लाह ताला आपकी, और मैं कोई मेडिसिन नहीं लेता अल्हम्दुलिल्लाह, ना ब्लड प्रेशर की ना किसी चीज़ की भी नहीं लेता। तो आपसे रिक्वेस्ट है कि आप पहले एक्सरसाइज करें, और अगर आपको लहसुन गार्लिक आपकी बॉडी के लिए अच्छा है, इस एज में मैं नहीं कह सकता, तो आप ज़रूर लें। और ख़ास तौर पे पानी जब भी पिएं उसको गर्म पिएं, और खाने से पहले मैं पानी पीता हूँ, खाने के बाद मैं पानी नहीं पीता, वो 1 गिलास पी लेता हूँ, 1.5 पी लेता हूँ। तो ये मैं शेयर करना चाहता था आप सब भाइयों से, तो आप कोशिश करें। अस्सलाम वालेकुम।
जज़ाकल्लाह। किसी और ने सवाल करना? यस।
Assalamu alaikum, Dr. Sal. Thank you for your presentation. I just want to say something. You've mentioned all this. So please don't think that you're scared-mongering or anything, but the data that you've given us where, 200,000 people are this, 300,000. But the total population of this country is 60 million.
Yeah.
How do you equate that to the percentage? And the other one is, our Asian brothers, why is it that the government has gone to lengths to say, well, we from the Asian countries, the Asian origin, where the heat and we have plenty of exercise, we still end up with poor health? Now, I know recently the NHS and everybody have started health programs for everybody to join in at the local leisure centre, Darwin. It's free, but all this scaremongering about, well, if you're black, you will have more chances of getting this, more chances of that. So how does that correlate with what you just actually mentioned to us? Just, I mean, it's just a forethought. Thank you.
So I think that, it's because the distribution of disease is different. So Asians have more diabetes, and people of African origin have more high blood pressure. But what I was trying to say is that overall, you also have some things that protect you as well. So, for example, we have less alcoholism. Yeah. So the life expectancy, our life expectancy is still more. Yeah.
Oh, thank you.
I think the wider point is that whilst there are some things which are good in our lifestyles, there are still things that we can do better, which is that we need to focus on exercise. Not think of exercise as a chore, but make it a part of our everyday life, and to change not necessarily what we eat hugely, but the amounts that we eat, the proportions that we eat, so that we are focusing more on fruit and vegetables and a little bit less on the very calorie-rich foods, which we perhaps like to eat a lot, just eat a little bit less of them, that's all. So it's just a slight tweak or change. But it doesn't take away from the fact that if you are from an Asian background, that does increase your risk of diabetes, which leads then to an increased risk of heart disease and stroke. This is a fact.
No, but then if you narrow the number down for the Asian population, it's still far less than what is being put across. Thank you. Okay.
Sorry, I'm not sure I understood your point.
Yeah, I didn't understand. Sorry.
We come from a hot climate, and obviously the hot weather and the way we exercise and the way we walk and everything else that goes with it. But this, we will have that definitely because it's hereditary in the genes that we carry it from our countries through our progeny. When we have children, they will carry it on as part of it. So we need to have some kind of preventive measures in so that children now going through the whole process don't end up with it or try not to end up with it.
So yeah, you're absolutely right. It isn't entirely hereditary, but you're right that there are things that our younger population should be doing to prevent them from getting these diseases, and it's all the things that we just talked about, which is exercise and a healthy diet. Exactly.
Yes.
Last question, I think.
अस्सलाम वालेकुम सर। डॉक्टर साहब, मैंने एक अपना तजर्बा आपसे शेयर करना था कि मुझे 2 दफ़ा ब्रेन हेमरेज हुआ है और दूसरी दफ़ा जब स्ट्रोक हुआ था तो इतना सख्त हुआ था कि डॉक्टर कहते थे किसी टीका लगाएं और फारिग कर देना अगले जहान ना। जर्मनी में ये मामला हुआ था मेरे साथ ना, मगर उसके बाद अल्लाह ताला ने मुझे सेहत दी। मैं पैरालाइज हो गया था, व्हील चेयर पर चला गया था। तो एक प्रोफेसर का मैंने ना एक लेक्चर सुना था जर्मन में, उसका ये कहना था कि जब हमें ब्रेन हेमरेज होता है या हम पैरालाइज होते हैं तो हमारे मसल कट जाते हैं, और अगर हम ट्राई करें तो खुदा ताला ने ये सलाहियत बख्शी है कि वो मसल दोबारा जुड़ना शुरू हो जाते हैं। तो ये जब मैंने सुना था पहले ब्रेन हेमरेज में, उस वक्त मैं बिल्कुल पैरालाइज नहीं हुआ था, मगर दूसरे ब्रेन हेमरेज में मुझे ये याद था कि मेरे साथ ये मसला हो गया, मसल्स मेरे काट के होंगे। तो मैंने लेटर एक्सरसाइज ऐसे बाजू लाना शुरू कर दिया, टांगों को मूव करना शुरू कर दिया, जितना मुझसे होता था ट्राई करता रहा। एक दिन आया अल्लाह ताला के फजल से मैं वो व्हील चेयर से वो स्केच पे आ गया, स्केच से नॉर्मल चलने पे आ गया। अभी बिल्कुल नॉर्मल लाइफ अल्लाह ताला के फजल से गुजार रहा हूँ। तो ये इसमें काफ़ी इम्प्रूवमेंट। और दूसरी बात ये कि मुझे कल की बात है कि मैं डॉक्टर के पास गया तो मेरी तकरीबन काफ़ी अरसे से 20 जो होती है, जो शुगर से जर्मनी के लेवल के हिसाब से 400 होती है, 400 कभी 20 कभी 25 ऐसे ही। तो मुझे डॉक्टर ने बहुत दफ़ा कहा कि वो आपको ब्रेन हेमरेज हो सकता है, दोबारा भी ये भी हो सकता है, वो मेरा लेवल ठीक हो ही नहीं रहा था। मैंने कल से आज तक वो खुद ही घर में एक पेस्ट बनाई है, वो इस्तेमाल की है और बार बार शुगर चेक कर रहा हूँ। तो आज सुबह जब मैंने लास्ट टाइम चेक की थी सुबह, तो मेरी 7.5 थी, वो 20 से कम होके वो और उसमें डाइट वो ब्रेड वगैरह छोड़ी है, कल की मैंने 2 दिन हो गए हैं। तो वो पेस्ट और हल्की फुल्की ब्रेड खा रहा हूँ अल्लाह ताला के फजल से। السلام علیکم.
نہیں نہیں بہت ماشاء اللہ. Are we supposed to finish? Yeah, or question?
Jazakallah.